we'll see.
Okay. Well, perfect.
It was
Well,
a beautiful, interesting experience.
yeah, it really does sound like that. Well, thank you so much for being here, Massimo, and thank you everybody for joining us. So my name is Anna, and Massimo has a long experience with homeopathy, practicing for over 40 years, and he is going to have a presentation on his new repertory, Suggesta, that is just coming out in Reader Opus. If you guys have any questions, if you can write them in the Q&A, and I'll ask at the end. We'll have some opportunity for questions at the end. And we're very much looking forward to this presentation. So thank you, Massimo, for being here.
Thank you, Anna, for this opportunity.
Yes.
Okay, can we start?
Yes, we can start.
Are you recording? Would you like to record it?
I am recording, yes.
Very well.
Yeah.
Okay, so I have to say good evening in Italy, but you know, for Anna it's just lunchtime, and for others probably another time too. So as Anna said before, I think it's really beautiful that technology can offer us this opportunity in such a difficult moment where communication is so critical. So I would like to inform you about the work which I did. You know that, in my opinion, our literature, our homeopathic literature, is probably redundant of books. I think that we have even too many, probably very often repeating more or less the same old stuff. In the case of repertories, we have plenty, but not as much as we have in terms of other material American and other books, probably because writing a repertory is really a very, very difficult and long-term experience. I would like to inform you about what I did, because I suggest it's not a repertory in the real sense of this word. First of all, I did not this work by my own. It should have been impossible. I was the ideator of this. It was an idea of mine. I thought seriously how to make it possible for years and years and years. It took to me a long time before I could decide how I wanted this book done. And then I decided to try to make it possible, only because of the help of this friend of mine that now are not here with me because they cannot speak English as bad as I do. They are even worse than I am. And so I am the one who has the task to present this work to you all, but I'm doing this in the name of the group. So let me explain you, please, first of all, for a while, why I had to do that, why I was forced in some way to do this work. And then let me explain you as better as I can try to do something about how Suggesta is designed, because it's very different from the other repertories that you can know. First of all, these are my colleagues, the ones with which I did this work, and they are very happy to introduce this work to you too. And let me thank Zeus Software, because, you know, it's not an easy and a common task to trust, to believe in that project, and to allow me to share this experience with you. So let's try to give a look to the peculiarity of Suggesta. Let me say that I started this project in 2008. Let me say that 12 years ago, I was almost obliged by my best friend, David Workington, to do this work. At that time, he had in his programs my additions, there were already almost 25,000. It could look a lot, but I will explain you later on in a few minutes that I'm doing this work for my very own purposes since more than 20 years ago, 30 years ago, more or less every day. I have a very fixed obsession about this. And because I'm working with a database where I type whatever happens during the consultation, where I'm typing the text of what patient says to me, literally with their own words, and where I'm typing all my observation and so on, I was able to collect since 88 up to now a huge amount of data, a huge amount of information collected with the words of my patients during the consultation. So what was my task? More or less every day for 1 hour every day, and I'm saying seriously 1 hour every day, was to study what I did during that day and to try to search from the few good cases which wasn't common to one case and the others, only for very special kind of cases. So when David insisted, Massimo, you have to work on a repertory, it was a very difficult moment of my professional perspective, because homeopathy in that time was a kind of difficult stuff for me. I almost wanted not to continue my work. So I learned to use the repertory when I was a student, more than 35 years ago. I started, as most of you probably, the one which are differently young as I am, starting from the Kent, arriving to what now we have. Of course, I used for a long time a synthesis, and then, as you know, probably I became a KHA user. I worked up to now since the program of Mac Repertory, and so I was mainly using the complete. And the complete that day by day became inflated by my daily additions. Okay. So what happened from that moment on? What happened from the time of Kent up to now? I think that there was a big effort from many of our community to add and add and add and add symptoms. So our repertory, not only our repertory, but at that moment, I would like to talk only about this, was inflated, is becoming inflated. And after more than 30 years, I think that we have to face the same problem of every science facing the issue of big data. It means that now, in comparison to the time of Kent, when it was mandatory to improve and to enlarge a very little repertory, now we have probably too many information, which I don't think, only in my opinion, are not that essentially, are not always clinically confirmed, and they're not mainly deriment. With deriment, I mean that probably the task, the good goal of every good homeopath, of every good teacher, is to give us the precise, clear information that should help us to make a very good differential diagnosis, not to consider whatever is possible in terms of the huge amount of remedies that we have in our repertoire. So another problem that for me was an issue since I was a student is how this wonderful, fantastic book, which is the repertory, is written, because still we're going on with the lexicon of that Victorian age, which is not so easy to use, you know. Mainly if we consider how this book is fundamental to train a good homeopath. And they have to learn at the end a code if we want to be correct. Because still nowadays, it's a code that we use. When you deal, for example, as I'm writing here, with the sense of guilt of the patient, and to call it still anxiety of consciousness, when you have to do what was seen at the time of our colleague, after Hahnemann, at the time of Ehring, even probably 100 years ago, when there was a swelling in our body, it was called a scrofula, correctly. They could not make the exams. Yes, now we need to say swelling of a lymph node for lymphoma is very important. So we're still in some way engaged in that kind of lexicon. Beyond that, without being at all, please, at all critical about the beautiful work done by Kent, many of this lexicon, many of these words are, in my opinion, surely not only in my opinion, extremely judgmental. When you read something about lasciviousness, lack of moral feelings, and even problems like cretinism of idiocy, remedies that could be look, first of all, with some cognitional problems and not necessarily. They can be cognitional only when they are so severely decompensated. I think that still nowadays using those words, mostly for our students, can be a serious problem. So as I said, it's not only difficult, I can see that many of you now are not English. They can be German, Dutch, Greece, someone from Italy I've seen. You don't have only to learn English. You have only to learn the code of that English of that day, which has to be translated in what probably it could mean, and it could mean from different kind of homeopaths also. Which is an issue, because there is not only a discussion about the literal meaning of certain words and certain symptoms in our repertory, but the same symptom, according to different homeopaths, to different beautiful, fantastic authors, which did their best in order to improve our books. Very often, these words, this concept, these symptoms means something different from one author to another. Another big issue is that very often we have synonyms. Think about when you read in the repertory something about stiffness in our back or tension in our back. Very often it is exactly, or very often it is something extremely close. It is a synonym, but if you give a look to those rubrics, you find out different remedies. So, please, I'm not at all disregarding the beautiful work done by those colleagues. Not at all. I think it was mandatory, fundamental. This is what helped me and many of us, I'm sure, to help our patients. No doubt. But I think that probably this work can be done better. Very often they were extremely honest in adding occasional symptoms, what I call occasional symptoms. That means something that they really observed in their patients, but all those symptoms are not necessarily diriment, are not necessarily useful, as I say, to try to distinguish clearly one remedy from another. This is what I mean when I write non-diriment symptoms. And Hahnemann did fantastic work with 300 symptoms in his provings. Very well done. Now, very often, if you think about some remedies, some polycrest in our materia medica, you have remedies with 30,000 symptoms. And when a remedy theoretically could treat 30,000 problems, it means that it can be useful for whatever, not something precise. So my idea from the very beginning was that, first of all, the repertory is not a kind of Bible. Whatever is written even so honestly in this book, is not always true. It is something which is a honest report of what was observed in provings, what was observed in some clinical prescription, what was observed in clinical prescription where the goal was to help your patient for the next days. In some other situation, the goal from other authors was to help your patient for a longer time. So there was not a consensus about the meaning. Still, there is not a consensus about the meaning of a well-treated case. So I think that instead of thinking as it happened, I guess I've seen in many of my students, this idea that the repertory is a kind of Bible, that, you know, whatever is written there is the truth. I think that the repertory should be considered as a kind of Suggesta. And this is the reason why I decided at the end to call our work Suggesta. I think it's a suggester, it's giving us some suggestion, some ideas, because it's impossible, mainly nowadays, as it was at the time of Kant, to remember and to know all the possible symptoms for the all possible remedies that we have. But what I am expecting nowadays at the age of more than 60 from a good suggester is to give me something precise, concise, and clinical, something that was not only used in well-done provings, but something that was used clinically speaking in a very efficacious long-term way. So, as I told you before, it took to me a long time to decide how to arrange all this huge amount of additions which I made and how to offer this work to my colleagues in the best possible way. And I also started to think if I could dream about a repertory, how I would like to read, to see, to study, to offer to my students a repertory, which could be the best possible way. You know, some of our colleagues in the past, they tried to think about a repertory written and arranged in different ways. Even the same author decided during his life to change the settings, the layout, the way that a repertory is organized. There is not one way which is the best, of course. You can try to decide what could be the best according to your opinion in that moment of your life, in that moment of your knowledges. And so what was really a kind of enlightening idea for me was that I said to myself, so when you write a materia medica, you know that I wrote some books. At the end, you take the responsibility of saying, dear colleagues, honestly, this is what I've seen. This is what I've collected. This is what I get from my long-term cured cases. So I am informing you about my experience. This is what I have seen. I don't say this is the truth. This is what honestly I was able to observe up to now. So if this is possible for a materia medica, if you know that anyway this is a subjective perspective, why this perspective cannot be as subjective even when you write a book like a repertory? So for that reason, I decided to call it like this. So we decided to consider that a kind of subjective perspective could be used. So we started from the skeleton of my additions. We tried to follow as much as possible a well-known structure, which was the one of the mother of all the repertories, the one of Kant, in order to offer to our colleagues a book which was not too difficult to restudy from the scratch. So at that moment, more or less, there are more than 30,000 additions confirmed clinically from my cases. But that was not my only goal. My idea was also to try to adjust, to correct, to delete what in my opinion, what in my experience was not that consistent, and to try to shrink this work. This is one of the most important issues, because I don't think that we can continue to go on this idea of inflating our information that was important more than 30 years ago, that was important after the beginning of our homeopathic medicine. Now, I think that we are extremely happy that Opus does exist, that we do have SHS program, that we can use a computer. Otherwise, all this amount of data would have been impossible to be used. But one of the reasons why many of us prefer to remain attached to origin is because it is much less difficult to work on a little amount of probably very good information that having to do with such a huge amount of big data. So just a few things to clarify what I mean with my additions and why I consider that, so reliable. Whatever I consider is coming from cases where at least I must have 4 or 5 cases where the same symptoms are in common in all of them. I only take material from cases where this remedy was prescribed as the only one in every acute and chronic conditions for at least 4 or 5 years. I do my best in order to inform my colleagues about those results and those symptoms. And if possible, I use the confirmation of my colleagues as something important, because this is not something which I only was able to observe, but it was seen from my colleagues as well. So the target, our dream, is to keep going on with correcting, grouping those synonyms, defining what is more diriment. So the main issue, which I would like you to understand very well in that moment, this is the reason why I'm introducing this, is that what we're doing is not a repertory like the other. I do extremely appreciate and esteem, really from my heart, the work done by Frederick and other colleagues, which are dedicating their life to write beautiful repertories where the main goal is to collect information as faithful and more precisely as possible from our literature. This is not the goal of Suggesta. The goal of Suggesta is to shrink as much as possible, is to correct, is to delete, is to try to focus as much as I can on clinical experiences. So this is the main reason why I insist. We started from the skeleton of my editions, and on that, little by little, we try to combine this with the repertory that, by the way, is shrinking and getting more precise, as I hope, instead of becoming a beautiful work of whatever is truly coming from our old books. This is the most important issue that has to be understood. Otherwise, we don't understand the main goal of Suggesta, and the reason why I call it Suggester and not Repertory. So the first draft of this book was ended the last August. From that moment, I am so irritated, let me say, because I cannot continue my daily work of making my editions, because we needed something done, something that can be published. Otherwise, it was not possible to update this continuously. And only in the last few days, I'm able, this is the first time in my life that I have such a long period of time, which is more than 6 months, without keeping going on with this work of adding symptoms in the repertory. So the work is continuing. And it will be regularly updated. The most important ones will be updated more or less every year. And I made this work, and I'm again truly thanking Opus for this opportunity, for what I consider the best two programs in the market, Opus and now Synergy. So please, this is a book, this is a text which, in my opinion, has to accompany and not replace at all the other repertory. It's book side to the others. And by definition is subjective. There is a bias on this text, which is born from the perspective that I am assuming my responsibility of saying you, this is what I've seen until now. You can consider that valuable? Yes. You can consider that not valuable? Yes. You can consider that useful? I will be very happy, but I am informing you about what I did successfully, and what I was able to observe up to now. Just few things. Now we are changing topic in order to start to explain what you can see in Suggesta. I say start to explain because I don't want to annoy you with a too long presentation, but please consider that I'm giving seminars about the use of this book, because at least when I did my last one, it took 4-6 hours in order to explain it more or less decently. So what I'm doing now is something very, very shrinked, very concise. And please, if you have questions after that, I will be very happy if I can to answer to you. First of all, how our sections are made. Something that I read in these last days was an issue for some of our colleagues, that our big sections, which are different from the one of the common repertories, are written in Latin. Why? First of all, because I love this language. Second, but not less important, is because this is the classical language of medicine. When you say, gastritis, colitis, diverticulitis, sciatica, pneumonia, all of these words are a combination of Greek, Old Greek, and Latin. So the classical language is that. I am sorry if some of you had problems. I got a couple of emails from colleagues saying if I knew that the big section were written in Latin, I would have never bought this program. Please consider that I am Italian. I had to study so much English in order to use the repertory, not the common English, but the English of the Victorian age to try to understand what is written. I really don't think that it's an issue to study less than 20 Latin words. Also because we have icons here, okay? And you can see in this icon what is written there. But the main reason why I wanted to do this as a distinction is not to be in some way strange, crazy, or what can I tell you, as a sign of being snobbish, okay? I think that this is the old classical language of medicine. I think that this is very clearly done in order to, from the very scratch, tell you that this is organized and done in a different way. And this is the reason why for me to use those few English words, sort of Latin words, sorry, is that important. So when you open the repertoire, instead of all the section that you know, you will have this, less than usual. Each one of these is divided in something else. For example, we have seen that throat, okay, is called in Latin ugulum. When you click on ugulum, you see that in there you have external throat, and every section is divided with pain, as originally even Kant wanted to do, and the other symptoms. So in every section, there is, for example, throat pain and external throat pain, internal throat and internal throat pain, larynx and trachea. So we try to consider region of the body from the anatomical point of view, as well from the functional point of view. So this is the reason why in human, which is the throat, we have internal throat, the larynx, the trachea, and also the function of this part of the body, which is to speak. So speech and voice are there. If you go in thorax, which is not that difficult, I think, for an English speaker, you'll find out that you have chest, of course, chest pain, as I told you. Every section has the name and the pain of this section. You have cough, you have whatever is in that region, the heart, the lungs, the bronchia, the pleura, and the function, which is the respiration. There is a mega section, which is called genitalia. Okay, here you have the female and the male, which are separated. Together with this, we have all the symptoms regarding the breast female in that area. And there is another section, there are few new sections. This one is called rejecta. Rejecta in English could be called as discharge, where together we decided to put in a functional way whatever our system is pushing out. So expectoration is together with perspiration, is together with stool, is together with urine. Please, I'm not at all telling you that I think that this is the best way to arrange the organization of our Suggesta. We considered after a long study that for us, that was the most logical and the most interesting. So for example, again, auditus, it has ear, the ear pain, of course, the function of the ear, which is hearing, and vertigo is there. In venter, you have whatever this part of the body has to do. So abdomen, abdominal pain, rectum, and so on. There are some new sections that in the other repertory are not like this. First of all, somnium, which is the dreams, is not in the section of the mind, which is called mens in Latin. So this section, some repertory was like this in some way, but in our case, this is a new section. A new section which I'm very proud of, because as I told you, we are 4 colleagues working together. Each one is working on special sections, and they will continue to work on their own special section. I am responsible of the mind section, the mens. I am responsible of the dream section, which is a somnium. I am responsible of correcting the work of the other 3 colleagues. So this is my task, which is the main important one, the most large. But in terms of correcting, adding, and things like this, my additions are all over the repertory, but I am adjusting and reviewing only mind section, mens, and dream, which is somnium. So there is another new section, which is rejecta. I just have shown you this, where you have whatever is discharged by our body. There is another section, which is called morbi. It's easily understandable even in English, like morbus. All the diseases which are present in the repertory up to now are all together there. They are still where they were. So if you seek for, what can I tell you, whatever has to do with pneumonia and inflammation of the bladder and so on, it is still in bladder. But you will find in that place a cross-reference, which is also pointing you to all the diseases. For the moment, this section is mainly interesting, in my opinion, because we collected in only one section all the diseases of our literature. Together with this, there are all the additions of the new diseases, which are not anymore just the main important ones at the time of Kant. There is also much more. So we added a lot in this direction. And I think that because our repertory is a clinical one, mainly a clinical one, we try to improve with a much more modern lexicon and with recent observation according to what we know. There is another section which is called thematis, which is about all the themes as I'm writing in my Materia Medica, but for the moment, this section is not in the first edition. It will come on the next one, okay? So just to give you an idea, this is the section rejecta, this is the section morbi, as it appears in your beautiful Opus program. What we did, I'm just giving few information, please. I cannot tell you all because it's too much. We did a lot in terms of enhancing and trying to rationalize the cross references. What I mean, for example, if you give a look in this one, we're talking about chest, thorax, respiration difficult. If you give a look here, you see that in comparison to the other repertories, there is much more. Many more cross references that were missing before, which are synonyms and pointing to the same kind of problem. If you give a look to those symptoms in the mind, for example, which is called in Latin mens, give a look to insecurity as a symptom. These are many other rubrics which are cross with insecurity, which are not in the common other repertories. And there is even much more which is coming about all the insecurity symptoms which can be related to this concept in other section of the repertory. What can I tell you? Perspiring in your axilla can be related to this problem of impotence, problems of going to the toilet too often, and so on. If you give a look to insolent, for example, here, impertinence, you find out even here how many more symptoms you have crossed with insolence, which are not in the common repertories. If you give a look also here to integrity, concern about your body integrity, which is a symptom that is only present in Suggesta, is not in other common repertories, can you see here how other synonyms, how other cross-references are added to the concept of being concerned about the integrity of your body, as the most of the arnica-like, for example. I'm giving you more ideas. If you give a look to affectation, you see you have more than this. If you give a look to this other symptom about the ailments for Bilenon, you see how many more cross-references you have. So we did a huge work. This is something which I did personally on trying to make the cross-references, the work on synonyms, as clearer or precise as possible. So some new rubrics were introduced, rubrics which were not existing in other repertories, with also some rubrics, some sub-rubrics, and we tried to group them when there were scattered symptoms. Give a look here. In food, we arranged something where you can put together whatever has to do with special kind of foods. So if you click on alcoholic drinks, you have all this kind of stuff which is scattered in different parts of the repertory. You see? For example, we're talking about this other section in generalities. You see how much under farinaceous food you have all whatever is related to this, instead of scattering all those possible kind of food in different parts of this symptom. Sorry if I show you sometimes the complete repertory, but the on which for example, invigorating, you see, is at the end with many more symptoms and of course also remedies in the same section. And also food and dreams is also arranged in different sections of the repertory. In head pain, you have together is related to this, organized in this way, for example. In hearing, which is called auditus in our case, you have this kind of information too. You have the same also in the section of sleep. I give you some other ideas. We try to do this work of collecting together symptoms related to infections, inflammation, even whatever is related to degenerative diseases. For example, you see in genitalia, you have all these kind of symptoms collected together under genitalia infections. In thorax, you see, in chest, you have all these infections connected together in the same kind of rubric. In a tumor, you have these organized in the one which are not so malignant and the malignant one, and arranged by localization and kind of tumors. In morbi, you see, you have this kind of connections which are putting together symptoms which are related one to the others. Okay? So you can see that there was a big work of adding together, of putting together concepts that by definition belong to the same issue. Again, we created in other section of the repertory something which has to do with food and drinks, as I told you. Some example of some new rubric. In any section, there is something about emotional symptoms, which are connected to specific kind of emotions. So in each one of these, this is the new Suggesta in the Opus version, you see this is venter, which is abdomen, abdominal pain from emotions. This is missing. And after this, you have all the possible emotions which are related to this symptomatology in your belly. Okay? There is something also about sensation, written and connected when it's possible, even from the metaphorical point of view. For example, here you have all the possible kind of sensation which are present in our abdomen, okay? But together with this, there is also something about the metaphorical. So where you try to describe something according to the words of the patient in a kind of metaphorical way, which is different from what can be just a simple sensation, as it is in this case. I hope it's getting clearer and clearer what we mean with metaphorical sensation. Okay. So Targa is back. You have also the other possible sensation related to this part of the body. Whatever is related, for example, to me, to milk is now moved in a female breast. And I hope it does not look so sexist, please, but it is, because we have in our repertory a lot of things about different kind of typologies of women, very little about typologies of men. I don't know if by definition, whatever is about men and something else is about women. It can be also the opposite. We don't know. But for the moment, this is arranged like that. A big work was done about the reorganization of the pains, the way of suffering. I give a lot of importance to that in every patient which I study, mainly when I have to do with constitutional cases, because according to my opinion, the specific way that every single patient is describing his pain has a meaning. When they say that a pain is prickling, is penetrating, is tearing, is unendurable, is maddening, and so on, I think that there is a very precise way of expressing how do you cope with your subjective body, what I call the corpus, which is different from the physical body. The physical body is the objectiveness of what it is, our system. The corpus is the way that you perceive it, the subjective perception of it, which is what we collect mainly in our homeopathic studies, in our proving, because we are not allowed to kill a patient with the cirrhosis, giving phosphorus, phosphorus, phosphorus. And the symptoms that are produced by our patients are a subjective description of something which is as if, and which is in terms of pain, a description of how the corpus, the subjective body of this patient is talking. So there is something about the direction of pains, which is not in the other repertories, and merely the characteristic, the way of suffering. I give you some examples. You can give a look, for example, now in generalities. There is a section of pain directions, and there is whatever is related to how those pains are moving in our corpus, in which kind of directions they are in some way radiating downward, transverse from one part of the side to the other, and so on. There is something about the characteristic. So we tried again in this case to arrange together synonyms and concepts related to pain. So again, in general, but this is all over in every section of our Suggesta, the pains are organized possibly in terms of logical concepts. So for example, here you see whatever is acute here is in some rubric organized in symptoms which are appearing acutely. Whatever is superficial, which means you are not deeply perceiving something which makes you suffer, but this is mainly on the surface of your body, has to do with that. And so whatever is here, something like superficial pains, is what you see here. Acute is an example of what you see here. This is an idea of how we organize our pains in every section, not just in generalities. Okay, this is again the continuation of the previous symptom, and this is the end of that. I'm just giving you an example because there is a lot about this. So let me talk now, because I don't want to annoy you too much, about two sections, which of course I know the most because they are the ones on which I did all my personal work. So the other section, as I told you, were done by other colleagues, and I corrected what they did, of course, using also my additions. And these are the two sections which I'm very proud to talk about. One is about the dreams, which I told you is separated from the mind, and one is about the mind. And these two sections were revisited in two complete different ways. Let's talk about dreams. What I did, what I tried to underline as much as I could in terms of my work, is the meaning of dreams, is the meaning of somnium, which is, according, let me say, to my psychoanalytical training, a kind of craziness, madness, complete out of proportion, complete out of thinking. It is something where in our life, in this part of our life, we can do everything. We can be two-person. We can be male and female. We can do in the meantime something crazy and something absolutely strict. This is the possibility of exploring our perspective of life in every possible direction. And mainly, it has practically nothing to do with the principle of reality. So the reason why I wanted to put it out of the men's section, the mind, is because eventually they should have been included under delusion. But you know, delusion again is another word which is a code, because delusion in English has a very precise meaning. Delusion at the time of Kant had another meaning. And under delusion, we have a lot of symptoms which are not delusional at all. They are just impression, sensations, ideas, way of perceiving, and something like that. If you think, for example, about the section vision, which is called visus in Suggesta, in vision, you have a lot of interesting remedies and symptoms which are much more related, which are much more close to delusions and visions and something hallucinogenic, possibly like this, not only objective symptoms because of some problem in your eyes, also delusional ones, which should probably belong to that. So whenever we talk about something which has very little to do with the principle of reality, our repertory is describing something which is not so easy to put precisely in the same place. So again, I wanted to give a very special emphasis on this. It can be probably because of my special way of thinking, my particular training in psychoanalysis, where I give a lot of information to those beautiful and meaningful symptoms related by our patients. And I think this is extremely interesting, even from the theoretical point of view, because, you know, some of us are insisting so much about the objectiveness of our symptomatology, which is true, which is clear, which is important. To be precise, in medicine, whatever is objective is called a sign, not a symptom. A symptom is whatever is subjective in our body, in medical terms, at least in Latin. Somnium, dreams, is the apotheosis of whatever is extremely subjective, if whatever has nothing to do with reality. And it is so interesting how much well taken, well used, this information can give us a huge amount of information to try to understand what's going on in our patients. And they have to be used, of course, not at all thinking in terms of something that can be exactly what the patient says. They have to be interpreted as whatever is not so clearly objective. So in the case of Somnium, I couldn't do so much a reorganization of the rubrics because it is what it is. So the most I was able to do was to correct, to combine, to redefine, to have a better organization of the cross-references. I eliminated some symptoms which in my opinion were too generic and confused. I took the responsibility, I told you, to delete what in my opinion is not meaningful. You can find out these symptoms in the other repertories, not in Suggesta. I just give you a few examples. In the dream Adventurous, as you can see, sorry if in this case I used my old complete, you can find out baryt, ozonium, senet, and sulfur. In this case, you have the added 231 means Mangialavori. You have the additions of what I've seen in my patients. This color means second degree. This color, the blue one, means first degree, even if I do not consider the degrees that important, but we will talk about this later on. So this is an example of just adding some important remedies in symptoms already existing. In this case, for example, you see there is a dream which is amorous, another typical Victorian word. It can be debatable what does it mean. So I did my best reading also what is written in the Proving and in the Materia Medica to use a modern lexicon. Those are erotic dreams. Amorous means very little today. If we want to help our students of medicine to start and study this book, I think we cannot keep using those kind of lexicon. Okay, so if you go in Suggesta, in amorous, as I told you, still the old symptoms are there, empty. There is cross-references, which is telling you, please, amorous has nothing in consulta, does exist. Click on erotic, and you have now erotic dreams. And you see that in erotic dreams, there is so much more, so much arranged, and some interesting cross-references which were missing before, because romantic has nothing to do with the erotic dreams, is somewhere else. And here you have some other, let me say, interesting symptoms in Suggesta, which are telling you something else, which in other common repertory is missing. So there is also an updating of the cross-references, and there are also some other interesting symptoms. I give you another example about those anxious dreams, which means almost nothing. So many dreams can be anxious. But, you know, I tried to add some cross-references which are trying to underline more precisely the possible meaning of this, even moving you to anxiety as a symptom, and also to quies, which is sleep, anxious. I give you some other example. In dreams of being betrayed, you see in some other common repertory, there is just one remedy. Here, from my clinical experiences, we have this, aurum muriaticum natronatum in the third degree. This is first degree. This is second. In your program, in Opus, it will appear as it is in the other section. See, about buildings, okay? It's something else and something more. Another example of missing cross-references. If you give a look to Dreams Coffins, there is just funerals. You see how much more, obviously, I had to add in terms of cross-references. I give you some other example. Dream embarrassment. It's not so immediate to understand why unsuccessful efforts has to be connected with dreams that are so embarrassing, and why shameful dreams are not related as cross with embarrassments. One, being closet or being spied has not to do with embarrassment. So there are correction, in this case, delete something like unsuccessful efforts, which I do not consider so consistent. Dreams about excrement, for example. There is something missing because there was dreams of Berlusconi, but I don't see that. Let me give a look. This is a crossing which is missing, by the way. So you see excrement, you have all of this kind of dirt, disgusting, and so on. I was making a joke, sorry, a stupid one. You see that repertory we use nothing in terms of cross. Here you have the ones. So additions and cross-reference too. You see now in unsuccessful efforts, this very interesting rubric, you see how many other interesting symptoms you have. To make a telephone call, to be unable to swim, to be unable to untie knots, and so on. So there are other cross-references, and there are other symptoms, of course, not only other remedies. For example, in this case, there is a new symptom. Dreams of competition is unexisting in our common repertories. And here you can see that I added something like buffo, first degree, epiphagus to third degree, and agaricus second. If you give a look to vivid dreams, okay, you see that there is also so much more. And also the dreams of volcanoes, which is missing in the other repertory. Let me tell you something about the mind, because in the case of the mens, we completely revised that. I say we because, of course, I was corrected by my colleagues. So the rest section, the first level, which apparently doesn't seem to be so obviously changed, even if there is a lot. We have correction on the second level, what we call the sub-rubrics, which are very important and very reorganized. There is a concept of concomitant that you will see more or less in every important symptom, and also a considerable additions and corrections, not only in terms of remedies, but also in terms of degrees, even if I tell you we can debate on this concept. Let me give you some examples about first level symptoms. If you look to agoraphobia, okay, you see how many more symptoms you have in Suggesta in comparison to the complete. Again, all those 2, 3, 1 are symptoms added by myself from clinical confirmed case with a long-term follow-up. For example, alcoholism, which in my opinion means pretty little for a couple of reasons. First of all, we are talking about the time of Kant. Second, probably at that time, alcoholism was the only, surely the main way, the best known, the most available way to use something as a drug. Now, we have so many more possibilities at our time, okay? So, in the original repertory, alcoholism is like this. In Suggesta, alcoholism has no symptom at all. You have a cross-reference, which is redirecting you to dependency addictions. And if you go to dependency addictions in Suggesta, you have dependency addiction from alcohol, and there are some corrections. There is a lot more of cross-references about whatever has to do with an addiction, okay? And I added also, from my experience, addiction to amphetamines, cocaine, cannabis, purgatives, sedatives, sex, tabagism, and so on, as you can see. Another example about what we have, the few amounts of cross-references and the few amounts of remedies that we have for fear of panic attack. First of all, it is debatable if it is a fear, if it is a phobia, or something else. If you give a look to panic attack is a separate symptom, is not a fear, okay? Is a special kind of a precise symptom where you can see a lot of remedies which have to do with panic attacks. You have different kind of sub-rubrics about different kind of panic attack, from the social panic, from dreams of fights, from dreams and sensation of being unable to control yourself in adolescent, okay, and some other cross-references which are missing for panic attack in the other repertory. This is another example, the sense of dignity, which is something that we don't have so clearly expressed in the common repertory. Here you have only 6 remedies. Here you have so much more. And here you have so much more in terms of cross-references for this concept of dignity. So you can see that differently from the section SOMNIUM, dreams, there is so much more in terms of reorganization. For example, dogmatic here is changed in Suggesta in conservator traditionalist. And if you go to this symptom, you have more remedies than what is in dogmatic in the common repertory. And you have also other interesting cross-references about intolerance and rigidity. There are also interesting subsection attached to triads, traditions, dogmatic, with also other interesting cross-references. Contradictory. It's another old term which can be debatable. So I prefer to use the concept ambivalent, as nowadays we mainly call it. And you see that you have this in comparison to contradictory. Many more remedies and many more and more precise cross-references. Contrary is a concept that, again, we consider a kind of old terminology. So it's called oppositional, and there are other kind of cross-references. Refuse the authority, disobedience, disposition to contradict. So contrary, there is nothing in Suggesta, but those cross-references which are redirecting to other symptoms that I consider more precise. So if you go to oppositional instead of contrary, as you can see, in oppositional, you have all these corrections, many more remedies, and many more and more precise, let me say, cross-references. Some new rubrics, which are completely missing in the other repertories. Orthorexia, for example, is a symptomatology, is a symptom that probably at the time of Kant did not exist or was not known as it is known now. Is a very interesting and serious food habit problem. Is a very interesting food disturbances. Many homeopaths that I've seen as patients does has this problem. Okay, so you see that here there is a new symptom, orthorexia, which is connected to all these other cross-references. We're talking mainly about children, not only children, but whatever has to do with a very independent kind of personality. As we have dependency, which is another interesting concept and a theme, a symptom, which is present in Suggesta. There is also independent, and independent is present there with all these remedies, and all this interesting, I hope, cross-references. The symptom of narcissistic, is not in other repertories. Victimhood, it's not in other repertories. Of course, all of these are information coming from my cases. All these are remedies where instead of religious affections, which is different for having to do with the strong necessity for an important spiritual life. This is an important component in the personality of these patients. So you see that there is a cross with mystical and with religious affection, but these remedies where the spiritual life is important is mandatory for the patients are added here, as you can see. Also concept like transcendence, okay. I hope I'm not going too fast and I'm not annoying you too much. Synesthesia is this very interesting symptomatology that appears in certain kind of drugs, where you put together the perception of noise, of some music with something that you can smell or that you can taste. So you can smell the beautiful music of Beethoven. You can perceive the sense of taste of something from Mozart or from Pink Floyd. And this is not present in our common book, Stoic, connected with the sense of dignity. So here we have to do the correction of the sub-rubrics. What is interesting is that I took the responsibility in several parts of the repertory to get rid of the time of the day, for a very simple reason that of course can be debatable. In my opinion, according to what I've seen in certain patients, it is extremely interesting that spontaneously they tell you something about what happens in a certain moment of the day. During the proving, you can have this spontaneously. Certain provers told you that in this moment of the day, I have this symptomatology. Very interesting. I think it's something completely different when you, as a doctor, when you, as a director of approving, decide that every remedy must have something occurring in special moment of the day. This is not at all spontaneous. This is not something really significant for this remedy. I give you an example. In certain kind of severely decompensated cases, where you have problems of depression, for example, to start a new day can be extremely difficult. So all the symptoms occurring in this moment of your life are extremely important. So in this case, symptoms occurring when you wake up, when you rise in the morning, leaving the bed, are extremely important symptoms. So to merge this one with whatever can appear in the morning or when you wake up for every remedy, I don't think is that interesting. So if you're interested in reading whatever is in the morning, 1 hour, 2 hours, and so on, use, please, other books. In Suggesta, you will not find out this information. You find out only when, according to what I think, to what I've experienced with my patients, it's really so important this moment of the day for this symptom and for this remedy. So if you give a look here in anguish, for example, in Suggesta, you don't have all this daytime, morning, forenoon, afternoon, and so on. You have those symptoms only, I insist, when they are really important. Another concept is concomitant, which is more or less in the majority of all the very important symptoms. What does it mean? In anguish, for example, you have concomitant. Okay, what does it mean? It means that you click on concomitant, you have this symptom of anguish, which is coming together with all these other symptoms. This is in our repertory. It's just reorganized, giving a special place to concomitant. So whenever you're seeking for a mind symptom, which appears, which occurs together with cholera, with fever, with headache, with the menses, whatever you want, it is always written under concomitant in every important mind symptom, together with what is concomitant. So here, for example, the symptom is laughing, okay, which is concomitant with asthma, chill, cholera, and so on, okay? Again, this is the symptom of restlessness, nervousness, which is concomitant with all these other kind of symptoms, okay? So something about additions and correction. Here, I give you an example. Give a look to affectation in the complete, in the old complete, please. Give a look to affectation in Suggesta, and give a look to the difference in terms of cross references and in terms of remedies and degrees. Give a look to anticipation, how many more remedies and correction of degrees we have, okay? Give a look again to, cannot give a look to block, to knife and blood, okay? There are, again, more remedies and also different kind of cross-references. Here is another example about claustrophobia. You see now in claustrophobia, you have very little here. Give a look to that. This is interesting about the compulsive disorders. This is what I had in my old computer, in my old repertory. This is what I did with compulsive disorders. There are other, as you can see, interesting sub-rubrics, and give a look to how many more cross-references you have for compulsive disorders in comparison to the old complete, which was the one which I used up to now. So this is a kind of relocalization of symptoms, which means, for example, faintness is something which in many remedies is just under unconsciousness in the mind section. It can be interesting to understand why unconsciousness meant that you were fainting and it is in the mind instead of in generalities. Very often there is this kind of strange misplace. So whatever had to do with fainting is in fainting in generalities and not anymore in unconsciousness in the mind. There is a cross-reference, of course. So I'm just giving you a few examples, please. I hope I did not annoy you too much to explain that we did our best, believe me, to try to offer a structure which is close as possible to the best known repertories, to whatever is in the synthesis, to whatever is in the different editions of the complete, to whatever was in the Kent, which is much thinner. But even if we try to respect as much as possible this, which means that the original symptoms are still there, don't be afraid. Often it can be possible, like alcoholism, that there is nothing for this symptom, but you have many cross-references which are pointing out, referring to more precise symptoms or even more expression of this modality. So even if we did our best, believe me, to try to respect this, it's a book, it is a text which is differently arranged. And there are so many more new symptoms and rubrics that if you don't know that they are there, it's impossible to find them. So my suggestion is this. First of all, if you are interested in the work that we did, take some time to study, to read it, as you did many years ago with the repertory, because you will find out many more interesting suggestions, mainly in the mind section, that you cannot even imagine, like transcendency, like orthorexia, which are interesting symptoms completely missing in the other repertories. I thought also about something else, because now both Opus and both SHS offer possibility of a much search for words and synonyms which did not exist before, that can help you to find out something that you don't know. But again, I insist, please, if you are interested in this kind of information, take your time to study it little by little. What we did is that we create a website which is called suggesta.it. We are offering in few weeks also the English section of this website. We started with the Italian one to test it. Why it is interesting to give a look to this website. This website is independent. It has nothing to do with Opus. It has nothing to do with SHS. It is our website. In this website, we put tutorials. So we will give you a kind of clip for 5-10 minutes explaining what can you find out about the problem of being obsessive, okay? And there are all the explanation about which kind of symptoms we added, which kind of remedies, which kind of sub-rubrics you can find out. So it is not a long tutorial. It will be divided by little concepts that you can study one by one, and you will have information how to give a look to seek for those kind of symptoms and concepts and themes in Suggesta. There is another interesting section, which for me it is really interesting. It is a section about you, which means that in English it will be called suggestions, which means that you can register and have an access to this page and say, dear Massimo, I found out this mistake, please correct it. Dear Massimo, I think that there is a missing cross-reference, which I think that you should add. Dear Massimo, please, I think that you made something wrong, or this can be adjusted. Dear Massimo, I've seen interesting cases which are treated successfully with this remedy. I promise, we do promise that, it is a fact that such a huge work is impossible to be done without mistakes. It is impossible, believe me. Each one of us corrected twice is work, and every time we give a look to that, there is a mistake that we have not seen. So this is impossible not to have. So please, 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 if you find out something incorrect, inform us. We can correct this the next day, and you can have this correction immediately in your computer if you want, because it will be updated regularly, and only once a year there will be a major upgrade with something very new inside. And please, if you have interesting suggestion, don't tell me delete the Latin words. It will not be done. If you can give some other interesting suggestion, we will be very, very, very happy to consider what you say, because we really want to create a possible community which can think in a different way and considering the idea of shrinking and making more precise our information. So this is what will happen in the new release. We, of course, will go on with this correction and new section and so on. There will be this one about the themes, which is extremely important, even if it's too small at the moment. Before ending this, I would like to thank my very special friend. You know that this work does exist. It will be done. Sorry for my cracked voice, only because I was pushed, pressed, obliged by David to do his work. This is one of the latest picture that we have together. It was the day he was told in the hospital that his cancer was invading his brain. So he had to do some radiotherapy. And so he had to shave and to get rid of his hair. In that day, I did the same of 9. And so to try to be close to my best friend, we went together to talk with the lady, which shaved us completely. Okay. It was just a way to show my sympathy. So I would like to remember him and to remember his beautiful work and to remember what he did, because without David, I would have never done this amazing experience of working again on the repertory. Okay, that's all for the moment. So if you have questions, I will be very happy to try to answer to you.
Perfect. Thank you so, so much, Massimo. And there are some questions. So one of the questions, some people have the Mac Rep Massimo editions. How does the Radar Opus, how does this new release compare to that? Are there new additions in the Radar Opus one?
It is the same. Whenever we will have a new release, it will be given to both.
Okay.
So I know that Opus, you were quicker. And so you have this suggest on your programs now. As far as I know, SHS will come out in a few days with their version, but it is the same.
Okay, perfect. And another question, have you found that this work where you're kind of getting the most essential rubrics of a remedy similar to THORAX repertory? Somebody saying that THORAX tried to shrink his repertory to the most essential information.
So you're talking about Fatak.
Yes.
He's a beautiful homeopath, which I esteem and appreciate a lot. I used his work a lot when I was a student. I still have his books in my library. So I did not copy, if this is the question, anything from his work. I learn a lot and I use his information a lot to learn more about remedies. I honestly don't know because I not even give a look to this work of him to do Suggesta, so I have no idea.
Okay, okay. And then Gabrielle is asking, is Suggesta purely your additions and observations?
What? Sorry?
Yeah, is Suggesta only your observations from patients?
No, not at all. There are all my additions, full stop. So for example, if you buy the latest synthesis, if you buy the latest reliable repertory, the repertory which is default in SHS, you will have in these two repertories a lot of my additions, the majority, okay? In Suggesta, there is much more because I gave to synthesis and I gave to reliable more or less the 80%. But all this resetting, adjustment, correction of symptoms and so on is not in synthesis, of course, because synthesis is a beautiful, excellent work done by another author. I insist, I would like to repeat, with a complete different task. The task of synthesis, the task of reliable is to correct as much, as better, as most precisely as possible the information which are present in our literature. This is not what I did. I took my additions, I used was what in Kant, I enlarged this with other repertories, with other information. So Suggesta is a repertory like the others, okay? Is a repertory like the others completely. But the intent is to reorganize and to shrink the information. So if you compare what is in synthesis and what is in Suggesta, in Suggesta you have at the moment some less information, not much less, and they are reorganized. But Suggesta works as a complete, as a normal repertory, as a complete, not like complete repertory, as a complete repertory. Of course, as I told you, for some issues, for example, my intent, my very personal, my very subjective intent is to get rid of information which, I insist from my perspective, are useless, are not really giving you precise information to differentiate one remedy from another. This is the reason why, for example, as I just told you, I get rid of all our symptoms where and when they are not, according to me, that important. Okay, so if you're seeking for whatever is published, please use a synthesis or use a synthesis together with Suggesta. If you're seeking for something which is focused on clinical and is reorganized, please consider Suggesta. But Suggesta is not at all only my additions. There are all my additions, which are not in the other repertories, and much more like in a common repertory.
Okay.
I hope it's clear what I'm saying.
Yes, yes, that is very, very clear. Yes. And another question, Massimo, have you added newer remedies such as the lanthanides? Somebody is asking of newer remedies.
I am adding something like this. So I have to explain you something very precisely. My additions concern my experience. So I'm very sorry, even if I consider the work of Jan Scholten extremely interesting. He's a good friend of mine and an homeopath which I admire a lot. I don't have such a good experience on these remedies. So I cannot add anything about lanthanides just for the very simple reason that I don't have cases well cured with my standards with lanthanides. In the other books, the one of Jan, for example, there are missing all my experiences with fungi. I did a lot of research and provings and clinical cases cured with remedies which are not even published, like, what can I tell you, the shiitake mushroom, like lentinula edodes, like Ganoderma lucidum, and so on. So all this material is not present in other repertories, only in mine. So I think that in this historical moment, let me say, we should, in my opinion, move forward the concept of using just one book. In my opinion, it is extraordinary and extremely interesting that with Opus, as well with SHAs, you can repertorize from Materia Medica, you can repertorize from repertories, and using in the same clipboard where you're putting together the information that you need from several sources. This is wonderful and fantastic in my opinion. So my suggestion, again, is if you are interested, consider Suggesta as a book aside from the other. As a book which is done, I insist, with a very biased, with a very subjective perspective.
Okay, perfect. And Massimo, will all of your updates, will they be automatically updated to Radar as you're coming out with more and more editions?
This is a technical question which I cannot answer to you at the moment for two reasons.
Okay.
One is that technically speaking, you have seen in my presentation some shots from my program, which is the one where I typed and created Suggesta. From that program, I have to export all this data to Opus and to SHAs. They have to change it and to integrate in their own specific layout, which is not an easy work. So we have to decide how to arrange this for the future. My suggestion to both of them is to offer some minor update during the year, is to offer all of the corrections which they have for free every year. And every year there will be a major update that can be bought with a larger, consistent amount of information.
Okay.
I hope it's clear what I'm saying.
Yes, yes, that is very, very clear. And Massimo, to go off of explaining more of Suggesta, is there also proving material in Suggesta?
Yeah.
Okay.
There are
Okay.
some provings about, for example, some mushrooms, which does not exist in other books.
Okay, perfect. Okay. Okay.
Some provings about some milk, like Glama, and others which are missing. Some book about some experience about vinegar and something else, which is missing in other repertories.
Okay. Okay.
But I only used proving symptoms which were clinically confirmed. I did not add any proving symptoms like this just because they were coming from provings. Only the proving symptoms which I used and treated successfully in at least 4 or 5 cases with a long-term follow-up, not all the symptoms.
Okay. Okay, that is very good to know. And you are also getting a bunch of thank yous. A lot of people saying, thank you so much. I'm so excited for this. This is closer,
thank you for listening.
Yes, to our 21st century, you know, the updates that you're doing. So you're getting a bunch of thank yous from everybody.
Grazie. Thank you for listening, and I hope it will be you will find out this is an interesting work.
Yes.
I really did with my heart, believe me. It was a huge, tremendous amount of work.
Yes.
I hope it will be useful.
Yes, it's very, very useful for our homeopathic community. So thank you for all of your tremendous work, and thank you to your team as well who helped you with this.
Yes.
Okay.
Grazie.
Thank
you for your
so
listening.
much, Massimo.
Don't forget to give a look to our website, because in a few weeks we will have the English version. And so if you are interested in using Suggesta, there you can add us, please, 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 to make it better. Okay.
Okay. That sounds good.
Thank you so much.
You.
Grazie.
Bye.
Bye.
Bye, everybody.
Bye. Bye.